Hi there, I'm Jack Kelly with the UW-Madison Center for Journalism Ethics. Thanks for checking out our healthcare toolkit for local journalists. Today in our expert Q&A, I talk with Dr. Tiffany Green, a UW-Madison professor and a health disparities expert. Dr. Green had a lot of really insightful things to say about COVID-19, health disparities between communities of color and white communities, as well as on several other topics. Here's my conversation with Dr. Green. I hope you enjoy. Just to start, I want to ask about telemedicine. A lot has been made since the start of the pandemic about the future of telemedicine. People are discovering how convenient it can be. So I guess, just briefly, could you walk me through some of the positives of telemedicine, as well as some of the shortcomings of telemedicine, as we're kind of returning to normal, or something that appears like normal, and folks still might want to do appointments online, even if they could safely go back into their doctor's office?
Yes, I think we're definitely barreling, hopefully, towards a new normal. I don't think we'll ever go back to the way things were before. In terms of telemedicine isn't my particular area, but disparities are. And I think telemedicine has the potential to both widen and narrow disparities. What do I mean by that? Telemedicine can make things much more accessible for people that normally would not be able to access medicine, say for people that live in areas that don't have the right transportation. It can also help those of us who may not be able to get out of the house because, let's say, you are in a vulnerable population that is susceptible to COVID, more susceptible to COVID. Having telemedicine means that more people can stay home and more people can let our disease rates go down. In terms of the flip side, I think when we had these discussions about net neutrality and expanding broadband, this applies to telemedicine as well. People that don't have great access to broadband, people that don't have phone plans that allow them to easily access information or have enough data on their phones are going to find telemedicine very challenging. Add to that another layer with varying levels of health literacy in the population. I think it's really important for journalists to ask the questions, who is going to be affected, either positively or negatively? And I think my role is always to center the most vulnerable populations, because if we can make telemedicine accessible for them, then it's going to improve outcomes, I believe, for everyone.
Right. And you mentioned it there. I want to ask you more about disparities. Unsurprisingly, and unfortunately, I guess, the pandemic has only further exacerbated, and we've seen this play out, the inequalities in access to care, the quality of care, the convenient access to vaccines, the list goes on between communities of color and white communities in the United States. What are some things, and you mentioned one there, what are some other things that are often overlooked by local journalists when they're trying to cover these kinds of stories about inequality in terms of access to care, quality to care, that they overlook but are really important and should be considered by journalists as they're going about reporting stories like this?
I think, as journalists, I think you have a really important responsibility to question people in power and question systems of power. And the plus side is you're going to get the most interesting story. And by that, I mean, rather than accepting what people say about communities of color, rather than accepting what people say about poor people, go to them and ask them what their challenges are. I saw a lot in the media, the narrative, and even among scientists, this idea that vaccine hesitancy is the key driver of racial and ethnic disparities in vaccine uptake. Meanwhile, in places like New York and Florida, we saw affluent white people coming from outside, very more needy communities of color and taking up vaccines. And yet we're still talking about disparities in vaccine hesitancy when you have this kind of behavior. We're talking about hesitancy in vaccine uptake when we see such a challenge with trying to even book an appointment online. I am a fairly well-educated person, and I had challenges booking my vaccine appointment. And honestly, I found it not through my job, but through talking to friends and joining a Facebook group online for Wisconsinites looking for vaccines. I think that, coupled with the general challenges of accessing care, for poor people and or people of color make it really important for journalists to dig under the surface and honestly ask, why do we see these disparities other than differences in individual level behavior? Why do we see that some communities are more likely to be on Medicaid than others? Why do we see that some communities are more likely to live in places where they don't have access to medical care? Particularly in Wisconsin, we have large communities. Rural communities here are mostly white, but certainly not exclusively, that don't have access to medical care as much as those of us who are living right here in Madison. Because of this, I think it's really, really important for people in the media to stop looking at this very surface level, individual level behavior, to understand population disparities, and rather look for how structural inequality it really relates to these outcomes. And that includes systemic racism.
Right. And I think those are all extremely important things to consider. There's so much more to a story about this than just, the statistics or the figures that you might actually get. I feel like with stories like these, sometimes folks forget, like, these aren't just numbers on a page. These are human beings living in a place. I feel like that can be overlooked sometimes as well. One other thing I wanted to ask about, as the pandemic stretches on, we're in month 14 or 13 or 14 or 15, depends on when you say the pandemic really started in the US. What COVID-19 related trends are you following that journalists should also be following, right? I mean, the talk now is how many vaccine doses are going out, who's having access to them. What are some of the trends that you're seeing that journalists should be paying attention to and they might not be right now?
Sure. A few things that I am paying attention to. One is obviously disparities in vaccine access and uptake. That's an obvious one. Another one that I have not seen as much discussion of is disparities in what we call long COVID. I'm seeing a lot of people talk about experiencing these long-term symptoms from COVID that we know may or may not be permanent. And I think that's particularly important given that we don't have the structural supports to provide for people with disabilities. We have a lot of administrative burdens that make it very difficult for people to access benefits that they need. So I think that's really important. And I think talking to some of the folks, some of the advocates from the disability community is really critical. I truly believe, based on the evidence, that we would not have as many people dead if we had listened to them, if we had listened to the discussions about expanding Medicaid funding and making it more flexible so that people could live in their homes and get care in their homes rather than stay in congregate settings where COVID has run rampant. I think those are some of the key things. I also think that we are going to see, more and more outbreaks of COVID in areas where people aren't getting vaccinated. So understanding why that's happening, talking to people who are epidemiologists, who are experts in immunology, rather than going to people who are internet influencers. And some of those are MDs. I hate to be negative in that regard, but it's really important for your sources to be vetted. I don't talk about immunology. I don't talk about outbreaks in the sense of in a non-disparities context, because that's not my area of expertise. So it's really, I think, critical for the media, for journalists to take a critical eye to some of these influencers and ask, well, how are you vetting your information? How do you know this is true? What does the evidence say? What do these scientific articles say? And how do we know they are robust? And how we know they're valid? And I think given how rapidly some of the research has come out about COVID, I think we're going to have some long and challenging and tough conversations within the scientific community about the robustness of these particular outcomes. And then finally, this is my own personal thing, I think we're going to also have more and more conversations about expertise in health disparities. We saw early on in the pandemic that people were doing a lot of attribution of these disparities to genetic factors and behavior. And we know that these structural reasons are why we saw inequality. For example, the outbreaks in Brown County related to COVID we're in meatpacking plants. We're primarily to Latino or Latinx immigrants, right? But that isn't an individual level problem. It's a problem of regulation, and it's a problem of workplace protections. And all of those things have structural roots. And I hope that with this pandemic, journalists will continue to dig deeper and try to gain a better understanding of how structural inequality, whether it's racism and other sort of underlying characteristics, brought us to the situation where we are today. This isn't opinion, this is verifiable evidence from scientific research. And I hope that that will be elevated rather than this focus on individual level behavior.
Dr. Tiffany Green, UW-Madison professor and health disparities expert. Dr. Green, thanks so much for taking the time to speak with me. I really appreciate it.
You're very welcome, Jack.